Few countries are working as hard as Kenya to reduce the number of mothers and their babies dying during childbirth. That commitment has a powerful advocate in the First Lady of Kenya, who last year launched the Beyond Zero campaign with the compelling ambition that no mother should die in giving life. Kenya has for some time been working on a programme to address the deep and complex factors that lie behind its dismal maternal mortality rates, and the purpose of the Beyond Zero campaign is to accelerate it. The First Lady, the Cabinet Secretary of the Ministry of Health, and the county governors are now coming together to take forward the latest strategy in the battle. Kenya has already shown how it can rise to the other great challenges the region faces, making significant progress in spreading universal primary education and in promoting gender equality and the empowerment of women. But as the 2015 deadline for achieving the Millennium Development Goals races towards us, Goal 5, improving maternal health and reducing maternal mortality, remains stubbornly far away. It's a sad fact that every single day in Kenya, 15 women and 290 children still die from complications in pregnancy, in giving birth, from HIV and from other diseases. Most of these deaths are not only preventable, but we know how to prevent them. The causes of maternal mortality in Kenya are the same as in other parts of the world. They are hemorrhage, complications from hypertension in pregnancy, complications from abortion and sepsis. There are also the indirect factors, the largest proportion being HIV related. In all cases, however, the starting point must be adolescent girls, as it is adolescent girls who make up a startlingly high proportion of the maternal death rate. Millions of these girls in Kenya are coerced into unwanted sex or early marriage, increasing the risks of unwanted pregnancies, unsafe abortions, and other sexually transmitted infections, as well as HIV. Female genital mutilation is also a factor in causing death or disability to girls following childbirth. So I cannot emphasize enough the vital importance of keeping girls in school. Educating girls, giving them the knowledge to be able to protect their own health, brings so many benefits. Staying on at school can empower them to marry who they choose, shield them from harmful traditional practices such as FGM, and provide them with access to the right family planning services. So, we already know what initiatives can save mothers' lives. The challenge is in implementation. That is why the county governors have such an important role to play. With their local knowledge, they can judge which particular solutions would work best in their locality, and which kind of interventions can effectively be scaled up to improve the delivery of the right services for the mothers and adolescent girls. None of this would be possible without the UNFPA, the United Nations Population Fund, the Kenya Red Cross, and of course the Kenyan government, who together are pushing hard to galvanise national and international partners to reduce maternal deaths in Kenya. With this kind of backing, I firmly believe that Kenya can lead the whole continent in the development of innovative policy in this area. Last but not least, I simply must take my hat off to the First Lady of Kenya, Margaret Kenyatta, for running the London Marathon earlier this year to raise money for the campaign. I know from my own experience that one of the key ways in which wives of the Prime Ministers and First Ladies can make a real difference is by using their unique position to promote good causes. There can be few causes more worthwhile than this one, and there must be even fewer First Ladies who would be both able and prepared to run 42 kilometres in their support. Well done.